Bradovich and would like to welcome you to the podcast Certification Inspiration, produced by the Wound Ostomy and Continence Nursing Certification Board, otherwise known as WOCNCB. Founded in 1978, WOCNCB is a not-for-profit professional international nursing organization certifying over 9,000 registered nurses who are specialists in the field of wound, ostomy, continence, and foot care. In this episode, you'll hear from Kristen Benavides, a certified wound ostomy continence nurse, and Dr. Joga Ivatury, a board-certified colon and rectal surgeon and the chief of the Colon and Rectal Surgery for the Dell Medical School in Austin, Texas. They will discuss the important role a certified wound ostomy continence nurse has in both the inpatient and outpatient setting.
Hello, my name is Kristen Benavides, and I'm a certified wound ostomy continence nurse. Today, I'm having a sit-down conversation with Dr. Joga Ivatury. Can you introduce yourself to us, Dr. Ivatury?
Hi, I'm Joga Ivatury. I'm the chief of Colon Rectal Surgery at UT Austin Dell Medical School and practice at Dell Seton Medical Center at the University of Texas in Austin, Texas, with Kristen.
So, Dr. Ivatury, can you tell us a little bit about the value of having a certified WOCN, whether it's here in the acute care setting or the outpatient setting for your practice?
So as a colorectal surgeon, people with ostomies are very important to me in making sure they have enough support. And I think having a wound ostomy continence nurse in the hospital is really beneficial after surgery to make sure that those patients get good education, that they learn how to manage their ostomy, and they can troubleshoot. The wound ostomy continence nurse can also troubleshoot those patients with ostomies that come into the hospital with other problems and make sure that they get an excellent standard of care. Really the benefit also is from the outpatient side for those patients that get elective surgery. Pre-operative education with a wound ostomy continence nurse is absolutely imperative in my opinion. That way people can understand what an ostomy is. They can understand the differences between different types of ostomies and what specific ostomy that they were going to get, as well as give them education in terms of supplies, what the process is for ordering, all of those things. And then post-operatively from an elective setting, meaning surgery that's done on a elective basis, they can troubleshoot the patient's issues with ostomies after surgery, after they leave the hospital. Many patients say, I did it great in the hospital, but I got home and I'm having a lot of trouble, and the outpatient wound ostomy continence nurse is really helpful in giving that added education to people. So it's both an inpatient and an outpatient side. The best is to have that integration either with the same people or people that work really closely together. And then long-term with people with ostomies, I think that they should see a wound ostomy continence nurse at least once a year just to check the ostomy, to check that the ostomy supplies are appropriately ordered and that they're fitting appropriately, and perhaps there may be a need for a different type of supply based on changes in body contour or changes in lifestyle for the patient.
So, as having many residents learning so much about colorectal and the specialty, what are you teaching them as far as having one of our nurses around, with them? Because, they'll go off and to, another facility, and sometimes they may not have that interaction during their residency with a certified WOC nurse. So how are you incorporating that in your teaching with those residents?
So as a colorectal surgeon, I train general surgery residents, and they will many times go into specialties in which they will create ostomies. It's an emphasis of the preoperative care for a new patient that's getting an ostomy, including marking, including that education as I had spoke to. I mean, it's showing them that is absolutely necessary, and talking to them and making sure that a wound ostomy continence nurse sees a patient before the operation so that they get a good education and good marking. And then post-operatively, they show that they can see that I work closely with Kristen and the other wound ostomy continence nurses, and that I'm speaking with them on a regular basis, and some of that behavior will translate into them picking that up into practice. And then part of my package in coming here was to have an outpatient wound ostomy continence nurse. So the fact that we have one of those, or are in the process of having one start, is to see that in the clinic basis, when we see a patient with an ostomy, then they're also seeing that wound ostomy continence nurse right after that visit with me, so they see the integrated care and the whole care for the patient that's getting an ostomy.
All right. Well, we thank you for your time today, Dr. Ivatury. And for all those who are interested in learning more about becoming a certified WOC nurse, you can head to WOCNCB.org. Thank you.
Thank you.
Thank you for listening. WOCNCB sets the standard for wound, ostomy, continence, and foot care nursing certification by validating nurses' knowledge to provide safe, patient-centered care. Until next time, visit WOCNCB.org to learn more, or contact WOCNCB at info@WOCNCB.org. And remember to follow us on social media. This podcast is produced by WOCNCB. Take care.